Well, thanks everyone for coming out. Is my mic on? Am I okay, Lauren? Yeah. So again, my name is Dr. Lisa Taylor-Swanson, and I'm really excited to be here. East Asian medicine, traditional East Asian medicine, is one of my favorite topics. And while I could probably speak for 2 weeks straight, there's so much to say, I definitely won't. I think what I'll do is keep about the first 15 minutes, just kind of give some background and information. And after that, I'll speak specifically to how traditional East Asian medicine thinks about headache in particular. From that point forward, I'd really like to have a conversation. So at any point, if there are questions, just let me know. And then I have some handouts I'll pass out. Welcome. And that has, the handouts have a bunch of information that you can utilize at home regarding acupressure for various types of headache. So we have a lot to cover in just an hour. So from a raise of hands, how many people have received acupuncture, if you feel comfortable? So most people. Oh, great. So I'm kind of speaking to the choir in a way. So acupuncture is one of the tools in the toolbox that's used by practitioners of traditional East Asian medicine. So traditional East Asian medicine is kind of an umbrella term. It's literally 2,000 years old. We have textbooks that we still use that are that old. And not only do we use them because they're novel or sort of curious, but we actually use them to diagnose and to treat patients. So to think about that just for a minute, these old books, they're in Mandarin, well, they're in Chinese, it's spoken Mandarin, or any other way, but they have diagnostic frameworks that are used to treat myriad of types of diseases. And I just find that fascinating because, of course, if you think about modern medicine, which is fabulous, of course, saved my life twice actually, what we're interested in is the last, latest breaking abstracts. What's happening, this week or last year? Maybe we'll do a literature search of the last couple years, and maybe if we're really being a thorough researcher, we'll do a literature review of maybe a decade or two. But, do we ever read anything from the 70s, let alone the 40s or the 20s or, etc.? So again, just to fathom that we have relevant literature that's 2,000 years old. I always like to start with that point because it really helps make the point clear that this is such an old tradition. So again, acupuncture is one of the tools that we use. There's also, most clinicians are trained in herbal medicine. There's many different traditions of acupuncture, of herbal medicine. You may end up hearing the term traditional Chinese medicine. So of course that's the tradition that sprouted up in China and has moved all over around the world. Traditional Chinese medicine is taught in Latin America, it's taught in Australia. There's brilliant researchers all over the world as well. There's traditional Japanese acupuncture, traditional Korean acupuncture, and what's fascinating is that the traditional East Asian medicine, so again that umbrella term, the medical tradition has moved around the world rather long enough ago that we have new French traditions. So acupuncture has been in France at least a couple hundred years. Enough time for clinicians there to come up with their own, it's called a Nogier ear acupuncture system. Here in the US, we're research geeks, a lot of us, like myself, and so there's a unique system of acupuncture that's been developed to support women going through in vitro fertilization. So again, this old tradition, 2,000 years of literature that's been building up over time. The practitioners have moved around the world, the information has moved around the world as well, and we do have many different traditions, again, both of acupuncture and then also of herbal medicine. So those aren't the only tools in my toolbox though. Also there's cupping therapy. Has anybody seen cupping therapy maybe on the Olympics? Phelps, he had those circles all over. If anybody's received cupping therapy before, it's great actually for this rubbish air that we have here. So cupping, like for Michael Phelps and other athletes and the rest of us just having everyday aches and pains, cupping is wonderful for musculoskeletal tension. It's also wonderful for the lungs. So what I've done many times with patients, whether they're dealing with a common cold or asthma or very serious lung diseases like COPD, pulmonary fibrosis, is use the suction cups on the back. Now honestly, as a researcher, actually I should come back to my bio, I'll do that in a minute because research is a big part of what I do. as a researcher, I've tried to figure out how in the world suction cups on the back actually help the lungs. And it's made me think of the old-fashioned techniques of percussion. People with pulmonary fibrosis, it used to be that you'd have to bang on their backs to try to get the mucus out of the lungs and to clear the lungs. Nowadays, of course, there's compression things that are used. But I think that's a part of the mechanism of how cupping therapy can actually help the lungs. So long story short, with the bad air we have here, you might consider getting cupping therapy just to keep your lungs open and healthy as they can be. So acupuncture, herbal medicine, cupping, Tui Na is another tool in the toolbox, and that translates basically to massage that's used along the meridians and on the acupoints themselves. There's also moxibustion, which is a heat therapy. Has anybody had moxa before? That's the nickname. There's a bunch of different ways that moxa is used. So basically, that's mugwort that's been dried and then either used, the Japanese style is to use a teeny, like a rice grain size, directly on the body. You light it on fire and snuff it out right as it gets to the skin. So it sounds barbaric, burning something down to your skin, right? But it doesn't hurt. And that delivers the heat locally and quickly to that area. The Japanese style is to take moxa mugwort, to dry it and carbonize it, burn it into, put the charcoal basically into a stick. And so it looks kind of, and it burns like an incense stick, if you've ever burned incense. And you hold that indirectly over the area. It feels great. So for example, moxibustion might be used for if a woman's having painful cramps right over the abdomen. You know, instead of the new-fashioned way of putting a heating pad on the abdomen, you can use a moxa pole, heat the abdomen. The way we diagnose this is too much to get into, but also the heat on the abdomen is great for a certain type of diarrhea as well. My favorite thing about moxibustion used indirectly in that way is to turn a breech baby. So if a baby is not head down and about week 36, so 4 weeks to go, if the baby is still head up, you can actually use moxibustion on the small toe. Now, how in the world does doing anything to your foot have anything to do with the baby in the abdomen, right? That's crazy. But we do have research that shows more often than not it is actually statistically significantly effective in turning a breech baby. Now, any woman who's had a breech baby knows a manual version is really painful. So if we can have a very comfortable little warmth on our toes, that's much preferable to turning a breech baby. So again, we've got acupuncture, herbal medicine, cupping therapy, Tui Na, moxibustion. And all those tools are tools that I can use when I'm treating a patient. So again, this tradition that's 2,000 years old, of course, people have not changed that much. We modern people may have diseases at greater frequency than we may have previously, cancer, diabetes, whatnot. But most of the things we experience are not so new. And of course, people have been having headaches for millennia as well. So in a way, it's this tried and true kind of old-fashioned medicine. Whenever I'm giving a brief introductory talk, I always like to talk about safety, because of course, that's the first question. This is sort of weird. Why are we sticking needles in people or giving them herbal tea? It's disgusting. You know, how safe is this? And the good news is it's very safe. The safety profile with acupuncture in general is quite robust. The worst things that can happen would be needle shock. So people have the acupuncture needles inserted, you're laying down or in a chair, that's used sometimes now. And if it is too much for the body, it can kind of make you go into shock. So the needles are taken out. You're either kept laying down or moved to a laying down position, given a little water, people resolve quite quickly. I've never, in 16 years, 14 of those years were full-time with treating more patients than I had time to see. Never had it happen. So that's very rare. And then, of course, locally, where the needles are inserted, you might have some bruising, you could have some tenderness. The funniest story, my very first year in practice, I had a patient come out from the treatment room. It was his first treatment, and he said, "Whoa, dude, that was way better than any drugs I ever did." And I was 20 whatever, thinking, wow, okay. But now I understand what he's talking about, because most people during acupuncture and afterwards feel very relaxed. It's very comfortable. Those of you that have had a treatment know your own experience. And it's much like having a massage in terms of that kind of dreamy, swimmy sort of feeling. And that relaxation can last afterwards as well. A colleague of mine made the term or coined the phrase Aculand. And if you've experienced acupuncture, you might relate to that, where you just kind of drift off to Aculand and you have this relaxing experience, and then the clinician comes and takes your needles out. And often that Aculand sort of relaxation can last not that strongly. You can safely drive and whatnot, but can help us feel less tense, less anxious, less stressed for days to come. The other thing I notice is that acupuncture's effects, and also herbal therapy and all the other toolbox things I talked about, it tends to be a cumulative effect. So often the first treatment, people may not notice anything, or they might notice, yeah, I feel more relaxed, or maybe my headache went away, or it didn't come back as quickly. But over time, with repeated treatments, then they tend to notice, oh yeah, I'm not getting my headaches as frequently. I'm feeling, of course, less stressed, and then I sleep better, and everything gets better together. So that idea of everything getting better together, I think is a really important concept. The gift and the challenge of biomedicine, I kind of gesture. So we have acupuncture, Chinese, East Asian medicine, biomedicine. The gift and the challenge of biomedicine is it's very adept at pinpointing exactly what neurochemical is going haywire, what muscle, what specific mechanism do we need to treat, and that's great. However, that little whatever it is that we're treating with medications or surgery or whatever intervention, of course, is connected to the whole of you. And so that treatment, of course, can have side effects that can really be very challenging. And sometimes we just need the whole of us to be addressed. So again, I think that's one very strong benefit with East Asian medicine. Not only in terms of if you have fewer headaches or less intense ones, and then you feel happier, and then you're less anxious, and then you sleep better, etc. But literally, the way we diagnose and treat each individual is by finding out, okay, say the main concern is having migraines with my menses, but to diagnose and treat me in this case, I would need to know, how are my bowels? How's my mood? How's my if I have any other pains or aches? And by knowing all those data points basically about that particular patient, that would help me to determine which differential diagnosis within East Asian medicine to use. And that tells me as a clinician which acupoints to use, herbal medicine, etc. So no two people, say coming in for migraine with periods, would necessarily have the same acupuncture prescription, herbal prescription, etc. So it's really like the old-fashioned version of individualized or personalized medicine. It's kind of interesting that way. I'm just going to be keeping an eye on the time because I have some things I want to cover, and there's no clock in the room that I can see. So briefly, I just want to tell you a little bit more about myself and what I'm doing these days, and then we'll talk specifically about headache and also open it up for questions. And as Senihia mentioned, I'm here on the faculty in the College of Nursing. I actually am from here, so I'm a Ute. I finished my bachelor's degree in psychology and women's studies 20 years ago. I was pre-med at the time and really wanted to practice biomedicine. And I was researching in developmental psychology how mothers and infants communicate. It was very funny because I wasn't really interested in the topic, but the theory is what lit me on fire. And that theory was about dynamic systems theory. Long story short, it's how everything is interconnected, and we need to study that complexity. So knowing that theory, I thought, well, how do I make sense of biomedicine? Because we don't think about all that complexity. We just, again, that linear dive in, which again is super, but it didn't make sense to me. So being needle phobic, I had to go study acupuncture, which was really daunting because that theory is how we diagnose and treat and think about health. And again, this was 20 years ago. There was no integrative health, nothing going on that way. So there was no way I could practice biomedicine in this holistic sort of way. And nowadays, happily, that's the case. So I moved to Seattle, studied and did my master's degree there, started practice, started a family, and I missed research. So I had to go back to school. I did a PhD up there at the University of Washington. And then from there, I did a postdoc and have moved here again to start my research career. So I'm doing research regarding acupuncture for chemotherapy-induced peripheral neuropathy, acupuncture and mindfulness for chronic cancer-related pain. And my clinical and research interests are really focused on midlife women's health. So I'm also hoping to look at pain and opioid use among midlife women. So that's a bit more about me. Before I kind of launch into specifically how traditional East Asian medicine treats headache, are there any questions? Anything that's come up while you've been listening? Please.
Well, I'm listening. It says acupressure. You haven't mentioned acupressure.
Oh, yeah, thank you. Of course. So acupuncture, you can't needle yourself. So I'm going to teach you how to use the points that I would be needling if I could, but since you can't, we'll press. Yeah, thank you. And so the nice thing is, in that toolbox, if we don't have access to an acupuncturist, we can use acupressure, and it's safe for kids. These points you can use on yourself, on your friends. They're not specific in terms of differential diagnosis, so it's very safe to use acupressure that way. I use acupressure all the time on my children, so heaven forbids if you have children or grandchildren who are having a headache or having some of the other symptoms I have on the handout, acupressure is safe for them, so thank you. Yeah. So have you guys seen, and I should have put on the handout, but I didn't, and I didn't want to mess with slides, it's too formal. Have you all seen those diagrams of lines all over the body where the acupoints and meridians and stuff are, is that familiar? So again, I mentioned in terms of a pregnant woman, I would use moxibustion on the fifth toe on the side to turn a breech baby. That's because there's a line, a meridian that connects the toe, goes up the leg, through the back of the torso, up over the head to the inner canthus of the eye. That meridian, the urinary bladder channel or meridian, connects deeply with the uterus, and so that's why we work with the toe to affect the breech baby. And so those meridians are ways that we can think about how different parts of our body are interconnected. Most of the modern research on meridians, we can't totally explain. Like, is there really more chi or more vital energy in those places, or is there not? There's some interesting studies briefly that look at skin conductance, and it's higher along those lines that were identified 2,000 years ago. There's some really interesting research looking at connective tissue, the fascia that wraps around your muscles. So it's kind of gross, but if you look at a piece of chicken when you're going to cook it, that wrapping around, you know, that stretchy stuff, that's the fascia that goes around the muscle. That fascia, turns out, there's a multitude of chemical communication things that are happening there, and those seem to line up with acupoints as well. So again, there's these acupoints that are connected by meridians. We kind of understand them modern science-wise, but we can't totally explain it. However, what's also interesting in terms of research, again, me being a research geek, there are research studies that have looked at inserting a needle in an acupoint and inserting a needle in a non-acupoint. And then they've done these brain imaging scans and found that the brain lights up in certain areas for certain points and different areas for non-acupoints. So we have different pieces of research that seem to indicate something's happening at those acupoints. So one way that we think about headaches within East Asian medicine is, again, where all these meridians are running all over the body. If a patient comes in and said, oh, every time I get a migraine, it's like an ice pick to my eye, it's always the right side, it's focalized, it's localized, never moves, then I would use meridians that are in that area that are affected, and then also distal or faraway points that are known to work with that area, basically. So it's helpful because, as far as I know, and Cindy, correct me if I'm wrong, but biomedically, if someone says, oh, my headaches are only at the vertex, or they're only at the occiput, or they're only around the eye, we would want to differentiate in terms of if there's a vascular component or not. But I don't know of any treatment or any medication or even physical therapy that's for this location headache versus that location. So it's an interesting way to individualize treatment. So we think about where the headaches happen, and then we also want to know when we're treating patients if the headache is worse with fatigue or better with fatigue, better in the mornings, better in the evenings, better with food, better with drink, better with exercise, or better with rest. So there's a lot of things we'll ask about to try to differentiate, again, within East Asian medicine, what type of headache is this, so we can understand it. And then, of course, for women, much like biomedicine needs to know too, if those headaches co-occur with ovulation or with menses, or if they're just any day of the month, not related to the cycle. Let's see, so we want to know the location, the intensity. So just like when you're talking with your physicians or nurse practitioners, is it a 2 out of 10 or is it a 12 out of 10? You think you're going to die. Also, of course, co-occurrence, is there nausea and vomiting? Are you having photophobia where the lights bother you? All of those things will help us to figure out how to diagnose within traditional Chinese medicine. Any questions about that? That's sort of novel. Please.
Do you have any recommendations of places to go to receive Chinese treatment?
Yeah, absolutely. So I don't think I have a marker here, But
It's really random, but I have one.
oh, cool, brilliant. Audience support.
On that note,
you.
the other thing that I have found problematic is that most health insurances won't.
No, yeah.
They're typically very expensive.
It's expensive, yeah. My private practice in Washington State, actually Washington is cool in that way. They had a state law in 1990 that mandated acupuncture, massage, chiropractic, naturopathic physicians all be covered by health insurance. So there is lovely. California, Arizona, you know, et cetera, but here we are. So Rebecca Beck, Shattles or Shatless, I always forget. It's a weird thing with all the consonants. And it's Peak Acupuncture. She's brilliant. She's in Sugar House and Cottonwood Heights. Full disclosure, she's my acupuncturist, so I know her really well. She's great. There's also Community. It's something like that. Community is a community acuclinic, and this means that you're in a community of people, and so it's important to be aware that it's not a private treatment in a private room. Everyone's fully dressed and comfortable. Usually they have recliners that are in a circle. They usually use, and it's cheaper, they usually use points from the knee down and the elbow down, even to treat low back pain. We've got a point for everything in various places. And it's a sliding scale. I believe it's 10 to 40 or 15 to 40. This is a cool business model. It's only come up in the last maybe 10 years. It's much, it's quite a bit how acupuncture is rendered or delivered in China, because there's bazillions of people. They got to run them all through the clinic. So people often are out in a big room, and it's a different long story, but anyway, it's a community acupuncture setting. And again, in the States, it's only been the last maybe 10, 15 years that community acupuncture has been a thing, but it's more like a copay versus Beck, I think it was 110, and then follow-ups are 80. So if you have a flexible spending account, that's great, but it's really expensive pretty fast. So that's challenging. I know Beck well. I don't know the folks at Community, but I know a bunch of my nurse colleagues refer to that clinic, so I feel trustworthy of them. Oh, there's also Natalie Clausen. She is my first acupuncturist that I have ever had treatment with 20 years ago, and she's the reason I'm here today talking about this and not something else. She's brilliant. And again, I don't know her fee schedule now, but it's going to be comparable because she's in private practice. And those are really the only resources I know of so far. I only moved back here in July, so it's been a short time.
I thought we had one through the year.
At Huntsman Cancer Institute, so I know of that. Oh, you're right. There's a woman in South Jordan. Yeah, I just learned about her, actually.
Yeah, she's really nice.
Is she? Oh, good. Do you happen to know the fee schedule? Or?
No, I don't.
Yeah.
I just was very impressed that she came to one of the health fairs,
Oh, neat.
and I got to meet her and talk to her.
Dang, I was just in a meeting.
But she is affiliated
Yeah.
with the University of Utah.
Yeah, you're right. She's at the South Jordan Clinic. Do you remember her name by chance? I don't either. I was just in a meeting where I was trying to figure out how to connect with her, and I haven't done that yet.
She's really worth the time to meet.
Oh, good to know. So South Jordan, it's the U Health system.
Yeah.
And then if anyone's a patient at Huntsman, or if you're faculty at staff at the U here, then you can go to Huntsman for care. It's $40 a treatment. I went there for massage. It was amazing.
Is it Lynn Morgan?
Yes, thank you. Yep. I don't know her, obviously, but you do, and it sounds like she's been great.
I met her, and she made a big impression.
Oh, that's terrific. That is terrific.
So what did you say about treatment at the Huntsman Center?
Yeah, so any patient can receive treatment there and in the Wellness Center. It's right off the main foyer. And massage, acupuncture, they have a whole gym there. You can meet with a physical therapist. Massages and acupuncture treatments are both $40. And also it's open for university faculty and staff. If a patient needs to come in, then you get bumped, but otherwise, best deal I've seen. Oh, and also Beck is there a couple days a week at Huntsman. So, yeah, good people there. Any other questions? Okay, so let me pass out the flyers that I made, and we can go through some of the acupressure points. Oh, thank you. I appreciate that. So what I've done is made, I think it's about a 7-page handout. So you'll have this to refer to at home. And again, acupressure is very safe. I've never had an adverse event with acupressure. And especially when you're giving it to yourself. You can't squeeze too hard. And also, as I mentioned, it's completely safe for children, for a friend. This isn't by differential diagnosis like we need to use in the clinic. And hopefully there's one extra. I made 14. And if anyone came with a friend, maybe you could share. Thanks. Oh, do you mind?
I have an extra.
Oh, is there an extra? Oh, thanks. So the first point, there's 2 pictures of it, is Hugu, large intestine 4. So like I mentioned briefly, this long meridian that goes around the back of the body, that's the urinary bladder meridian. This point that we're talking about is on the large intestine meridian. They're named that because they connect strongly with that particular organ, whatever they're named after. And there's a myriad of functions for each acupoint. So even though this one's on the large intestine meridian, it doesn't mean it's only for bowel concerns. So just to be clear about that. So the way you locate this first point is basically by putting your thumb along your index finger and see where that line or crease forms. And at the top, that bulbous part of that muscle is where you find large intestine 4. So when I do acupressure, I usually just dig my finger in there. For me, a strong pressure works really well. And I often pinch. So I'll put my thumb here and pinch here. And you don't have to worry, it's not like down to the millimeter when you're doing acupressure. The general area will do the job. You can also use a pencil with the eraser and just kind of press on the eraser. And the cool thing about acupressure, a lot of the points I'll be showing you, you could do this when you're in a meeting, when you're in class, at work, talking with a friend. Nobody's going to really notice, especially if you stick your hand under your desk or something. That's been one of my favorite tricks for especially working with, I've treated a lot of teenage girls who are having painful periods and headaches, sometimes migraine headaches with their periods, and anxiety, they're stressed out. So using this point, and one I'll show you later, is great, because again, you can just do that under the desk and nobody knows what you're doing. So go ahead, please. Is it only on your left hand? Both hands. Great point. So every point except one, I think, will be bilateral. And you can press for a minute, couple minutes. You really can't overdo it. Question?
That was my question.
Yeah. It's really a nice thing about acupressure. It's not like taking a medication where you need exactly this certain milligrams or this certain interval, or it's all for naught. So, and I should say too, a Chinese approach to treatment really is strong, aggressive. So when they needle, it's a strong sensation. A Japanese approach, there's even contact needling where we don't even insert the needle. So then a Japanese approach to acupressure would be just to touch the point with intention. So you can, again, do whatever works for you. For me, I squeeze the daylights out of my hand and then my head feels better. But for you, that might not be the case. So you can kind of tinker with that and see what seems to have an effect. Likewise, it's better, say if you know, every day I'm starting to have a headache by 1 o'clock or something, then use acupressure before that and see if you can prevent the event from occurring. So use it for prevention, and then also if you find, it's that headache again, use it during as well, and it might help to reduce it. And then if you're really curious about it, use it for prevention regularly, and then make some notes, either on your phone or paper diary or something. And if you're able to take less frequent medication or lower doses, then that's great information for you as well as for your healthcare providers. Sometimes I've seen that happen. My private practice, I only needled people. I didn't use acupressure, so I can't say. But I would often send people home and ask them to do acupressure for themselves. So then it would be a combined treatment of acupuncture and pressure. the million-dollar question. I appreciate you asking that. So, no, it doesn't, to be honest. Whichever hand you can get to most easily, if you're on the phone, do this one or whatever. The million-dollar part of it, though, is there's literally like a mountain of literature that's been written over these millennia of some schools of thought say, oh, if you have a right-sided issue, you treat the left. And other schools say if you have a right-sided issue, you treat the right. In my practice, it seems like both worked. So, yeah, that's a very good question. And again, there's a mountain of thought on that. I'm kind of a pragmatist. Whatever you can get to, that's the side to use. And very often you'll want to massage the side for a while. If it gets kind of sore, then switch to this one. So large intestine 4 is like the headache point, bar none. Any student, first year of class, like this is what we learn. So that's the first one. So on the second page, you'll see I included a couple points to use if you have Sanjiao is the term of the meridian. If you have a headache on the side of the head, the meridian crisscrosses over the head, so I'm using this sort of a gesture. So often, like the ice pick to the eye, sometimes it's this whole area. The side of the head can be helped by Sanjiao 5, which is found, I wasn't able to make an extra note here. So this little word, sun, where did I put your marker? Sun basically equals your thumb width. So here on the drawing it says 2 tsun. And so the coolest thing, again, I was saying how this is the old-fashioned individualized or personalized medicine. Every person is their own yardstick in Chinese or East Asian medicine. So, for example, my hands are very small. So if I'm treating a super tall person, I would maybe use 2.5 thumb widths just because when I'm using my little thumbs on their bigger body. Because again, their yardstick, their thumbs are bigger than mine. So for yourself, your own yardstick, that's easy. Just measure 2 thumb widths up. And basically, between your radius and ulna, there's this nice sort of gap in the muscles there. And again, just press. Sanjiao 5 is an amazing point. It's Neiguan, it's outer gate. So it's this idea that if you're feeling stuck and like the gates are stuck, you use that point and you open it up so you can feel less stressed. And again, it's a master point for the side of the head. So the other point that's on here, the foot point, is spleen 6. That is an amazing point. There's actually entire books just on spleen 6. And how you locate it is the inside ankle bone. You want to measure your 4 fingers up from there, straight up from that ankle bone in this kind of a muscular spot there. It's an amazing point for period cramps. So if anybody here has miserable menses, this point is one of your best friends. It's fabulous. Sorry guys, again, gyne is my thing, so I talk a lot about periods and menopause and everything else. But who wants to have miserable periods? And nobody, and not anybody around them either. So this is a great point for that. Bilateral again, so you could, again, if you're just having this headache on the side of your head, if you're at work, you can just cross your legs like this and, massage your ankle, massage your wrist, and it's quite helpful. Any questions about how to locate those, or?
So this is just beginning at the
medial malleolus. Yeah, so that bumpy ankle bone. Yep, 4 finger widths up from that.
And where is this line?
Oh, great point. So the wrist crease. So if you have your wrist and you make a crease, when you flex your hand, from there 2 thumb widths up. Thank you. It's a really good clarification. Yeah.
And then it's just
And then it's what?
because I can't see here. What are you pressing?
Oh, good point. Yeah, so it's basically, if I make the little crease in my wrist and then 2 thumb widths up and just pressing there.
Just press in the
yeah, and then you'll see it. I really do just dig my fingernail in.
So it's above the second finger?
Yes, technically just above it.
Okay.
But when you're, again, using acupressure, measuring 2 up and holding there will be great. Yeah. It's great for carpal tunnel too. 2 for 1. Any other questions about either the wrist point or the, please? Did you have another question?
Well, I was going to ask later. I actually, so I get trigger points like in that spot.
Oh,
Which one you mentioned all the time?
Yeah.
Is there anything to like, you can have the opposite effect if you're having a lot of pain there, or is it just...
Oh, that's a good question. I've never seen that. Like if you had local pain and then have trigger injection. No, I think it's probably okay. I don't do trigger point therapy injections, so I can't speak from my clinical experiences that intervention, but using acupuncture needles locally, yeah, no problem.
I just do the pressure, like I find
Oh, neat.
that, so I'm getting it anyway, but I didn't know if I'm getting a trigger point, if that's bad or...
Right, right. That's, oh, now I see what you're saying. If when you use the acupressure and it's sore locally, that's a very good question. So the Japanese school of thought, actually, if we were going to be doing acupuncture, I would palpate for where it's the most tender spot, and then that's where I would needle. It sounds, again, barbaric, but it's where the chi is thought to be most stuck, so to speak, and so that's where you want to work. Biomedically, if that's where the muscles are most contracted and stuck, you know, that might be what's going on. Once in a triple blue moon, I've had the treatment where I thought it would relieve the symptoms make them worse. Very rarely. And it tends to be over-treatment. So I either used too many acupoints or left the needles in too long, it exhausted them, something like that. But again, that's once in a very rare situation. Yeah. Any other questions? Please.
Do you ever do dry needling?
Yeah, that's a great question. So long story short, it's like every profession, there's always a turf war, and that's a turf war right now between acupuncturists and nurse practitioners, physical therapists, medical doctors, on and on. So the concern is that if there's these various providers using trigger point therapy or dry needling, there's different terms used, without a lot of training, that harm could occur. So I have had patients that have had dry needling from physical therapists and come back and say, kind of like confessionally, I'm so sorry, I went and saw a physical therapist and they dry needled me and it got worse. So I only know from those handful of people, and I'm sure many other people went and got dry needling and got better. You know, they just stayed with that clinician, which is great. Really, I think the difference is this 2,000 years of theory and talking about how we differentially diagnose. We don't use this for every person with a headache, you know, that kind of thing. Totally different than a couple hundred hours or maybe even many hundreds of hours seminar for people to do dry needling.
Why is it called dry?
Because it's not acupuncture, so I think that's what they came up with to try to make it their own something. I mean, that's...
There's no medicine injected.
That too, absolutely. But it's acupuncture is what it is, but just calling it something not that, so then it could be in their scope of practice. Yeah, I mean, it's the honest truth. So.
Legality.
Yeah, it's totally legality. Yeah. For a short time, I served on the Washington East Asian Acupuncture Association committee dealing with all these things in politics. And I realized I love practice. I love research. I don't love politics. Let those other people, yeah. Okay, so then on the next page, we have an amazing point, Bai Hui, means 100 meetings, at the top of the head. And you find this point by... Oh, that's interesting. I have two pictures later and one here. Well, anyway, you find it by measuring from the top of your ears and up from your nose. And this is an amazing point, both for vertex headache, so it's sort of natural. If your head hurts, you rub there often. And with this point in particular, when I'm locating it on a patient, I'll feel for if there's a little sort of soft spot or a little dippity-doo, or if they say, oh yeah, that's tender. So you'll know for yourself if there's any noteworthy place, one millimeter versus another. But just again, up from the ears and up from the nose.
Wait, up where they cross?
Exactly. Yep. The intersection of those two. And it's a little tricky, if you're in your office, you can't see yourself, and who knows where your nose and the top of your head are, but if you get the top of your head, the general vicinity, you'll be fine.
Maybe just have a tattoo.
Yeah, exactly. Little X marks the spot. And that's one point you might use, again, you could be in a meeting, massage your head for a few seconds, nobody's going to think anything of it. And it's 2 for 1. It's amazing for fatigue. So we'll talk about that more in a minute. So that's that point for vertex headache. The other point lower on that page for facial headache, so again, that ice pick to the eyes or frontal headache in general, liver 3 on the foot is the point that we're going to use. So it's basically the corollary of large intestine 4 on the hand between the first and second digit. We're going to be between the first and second digit, or first and second toe, in the meaty part of your muscle right there. So if you were just to pretend this is my foot, X marks the spot for liver 3. It's not quite that easy because, of course, your hand is shorter than your foot.
Work for optical migraine.
Excuse me. Yeah. Yeah, liver 3 is an amazing point. Together, the hand point and the foot point, they're called the 4 gates. And they're very strong to open up, again, if you're feeling stuck, stressed, anxious, the chi is stuck, you have a lot of pain, those 4 points are amazing. Yeah.
So there are 2 points on here.
Oh, yeah.
Like the red dot or the?
Yeah, liver 3, tai chong, the red dot. Great question. The print is a little fuzzy and a little small. Honestly, either of those points will be amazing. Liver 2 is indicated more for liver fire. So if you have red eyes and you're sweaty and you're hot and you're angry, then use liver 2. But they're only on most people's feet maybe an inch away. So the general area, you'll be there.
If you hit in one of these points, if it feels, if you feel a little bit of, I don't mean pain like you're hurting yourself.
Right.
Does that typically indicate, yeah, you've got something going on?
Yeah.
So keep going at it.
Absolutely. And often keep going at it, gently, kind of see if it eases, that tight or tender sensation. Absolutely.
So I know like when you're stretching your muscles, it's like 15 seconds is the window that you work in. Is there,
Right.
how long should you be?
Absolutely. Honestly, I usually use maybe a minute or so on each side. That's what I found to be effective. I would say like 5-10 seconds, probably not long enough. 15 to 30 maybe, but more, I would definitely say longer is better. Yeah, so a minute or so each side.
On the foot point, is it the same measurement as from the thumb width?
Oh, it's funny. That one is not measured by Tsun. How we find it is, say if this is my foot again, going up to where you can feel the metatarsals, the bones there, and then down just a skosh from that, that's liver 3. Whereas liver 2 is really close to the webbing of the toes. So that's a great question. So if you're finding where those bones come together, then just down from that, so you're again in the fleshy part of the foot, just like here, you're in the fleshy part of the hand. Sorry, I'm wandering all over, Lauren, huh? Not hard to see on the camera.
It's not between the big toe, it's between...
Yeah, between the big toe. Sorry, I was diagramming just where I could feel the metatarsals. And the one over. Yeah, so actually to be these bones here and going to the fleshy part there. Thank you.
So doing this, I can feel a great deal of sensitivity, like, okay, I'm on to something.
Yeah.
I do not have a headache facially right now.
Right.
Back of my neck.
Mm-hmm.
Like this.
Tight.
Does that have anything to do with this? Because I don't have a headache.
Right.
My eyes right now or facial.
Right.
At the moment.
That's a great question. So liver 3 is...
Up something.
Yeah, liver 3 is amazing. And again, that plus the hand point are sort of any tension in the body, any stuck chi, those are the 4 gates and used for that. So I think that's a great question. Definitely if it's sore, chances are that's a good spot for you to be massaging, regardless of the handout. Always listen to your body before my handout. But in this case, the handout is safe information. Yes,
I
ma'am.
noticed on your first one you used your finger underneath as well.
Yeah.
Are the
Yeah.
rest of them just on the top, or
Oh.
is it better to use more pressure from underneath, like with your foot?
Absolutely.
Underneath, or just pressing on top?
Yeah, that's a good question. Personal preference. For me, I'm a squeezer, so I definitely find strong pressure. I get more out of it.
Okay.
Other people light touch, but as long as you don't hurt yourself, whatever you feel inclined to do is good.
Okay.
That's a great question. Yeah. Any other questions?
It doesn't matter what finger you use.
No. Yeah, whatever finger you can use most easily.
Or an object like the
Pencil, eraser. Yeah.
Your thumb gets sore.
Yeah. I meant to bring, I have a dear friend back in Washington State who's a foot reflexologist, so she only works with the feet and the calves, and there's all these points all over the feet. And she gave me this wooden, it's like a curved and nicely smooth dowel, basically. And I forgot to bring it, but whatever's comfortable and delivers pressure to the point, whether your hands or an eraser or something else. Yeah.
On the head one,
Uh-huh.
can you apply as much pressure as well?
Yeah, I mean,
Because I had a Chinese guy show me that one, and I would do as much pressure, but the Chinese guy kept insisting that I wasn't doing as much, like...
oh, yeah, Chinese way.
He was like insisting, like, no, stronger.
Yeah,
Yeah.
totally. I was so lucky. The school I went to was amazing, and I had teachers from China and teachers from Japan, from the US, and for sure what I was saying is the stereotype, because stereotypes are based in reality, and the Chinese approach, I mean, to needling, one of my teachers, he would needle the patient and say, oh, too pain, and the patient's like, yes, that's painful, and he'd say, very nice, and we'd be like, oh, and we'd explain to the patients, don't worry, he's not a masochist, really, he's just trying to explain strong sensation will deliver a very nice result. Whereas the Japanese style clinician and Japanese clinician, you know, he'd do this very gentle needling, again, not even inserting, just contact needling, like a massage almost, but happened to be holding a needle. It was amazing technique, very different. But he would say, you just touch the point and think of wellness, and then you're better, which is great, but...
So they use energy,
Mm-hmm.
because they're using chi.
Right.
It through so that the vibration of the energy actually did it just as much as the hard pressure does. It dissipates it.
Yeah, I think so.
Yeah, because as you learn to use chi and send it forth,
Right.
then you don't have to use as much pressure. You can use more energy.
Right.
But getting to the trigger point and sending the energy along with the pressure,
Yeah.
it increases the strength of the eye
Mhm.
or their
Of that
energy
intervention or
goes to that spot,
something.
however we want to
Yeah. I mean, that's a great point that you brought up. Long story short, in research, here's the intervention. Usually everybody has to have the same thing, which is total rubbish in East Asian medicine because, again, it's all individualized. Every single visit, even, you know, say if you came for acupuncture, visit 1, the points I use would be very likely different from treatment 2, from treatment 10. So long story short, research is very challenging because we give usually the same protocol to everybody and then see how they feel at the end, which is fine in some ways. There's not yet a single study that looks at practitioner intent. There's other research that looks at like Qigong, you know, sending Qi or whatever, that's cool. But totally different than me as the clinician, I have this intention, I'm working with the patient, what's happening with that? Never been researched. Not that I've seen.
Of course.
Yeah, you know, that's so esoteric. For me to get NIH to fund that, no, we're not starting there.
It's really fun to learn.
Yeah, but you know, I think the way to do that is just design your research, do what you're supposed to do, and then collect additional data, and then do a secondary data analysis. There's a way to, you know, to do those things. So then, going to the next page. So I wanted to be very conservative and not put any kind of medical diagnosis or something. So basically this is a migraine headache. You're having throbbing, fixed pain, accompanied by nausea, vomiting, you know, sensitivity to light, all of that. But again, I couldn't say this is for migraine headache. So if you have that cluster of symptoms, then this group of points might be very helpful. So again, spleen 6, up from the medial malleolus, from that middle or inside ankle bone. Large intestine 4 that we've learned. And then the last one, oh, the drawing does not have a label. It's pericardium 6. Pericardium 6, we're going to see again in another page or two. It's an amazing point, both for pain, it's for nausea due to car sickness, due to migraine, nausea due to pregnancy, nausea due to being on a boat, any kind of nausea, chemotherapy nausea, you name it. So this one is 3 finger widths, and again, you want to make. The tricky thing is we have a bunch of creases, right? At least we have more as we age. So go from the main big crease here, 3 finger widths from there, and then under that third one. Pericardium 6, my favorite story about that, well, I have a bunch, but one of my favorite stories is you can buy C-bands. They're for seasickness. They're in every drugstore. So I bought cute little pink ones for my daughter when we would take road trips, and she would get nauseous in the car easily. So she'd wear her little Wonder Woman bands and not get nauseous in the car anymore. So if you find that nausea commonly accompanies your headaches or migraine headaches, you might look for those bands. And likewise, nausea. So whether chemotherapy, pregnancy, car, boat, whatever. Stomach flu, this could be great to just abate, sort of take the edge off the nausea. Yes, ma'am?
Would this one be so close to the tendons, should you steer clear of it if you have tendinitis, or is that?
Great question. I would needle it actually for tendinitis. So for acupressure, I would just use whatever amount of pressure feels comfortable. Nothing if it causes any more irritation or any discomfort. That's a great question. Yeah. So actually, we talked earlier about the point here that's 2 thumb widths up, the outer gate. This is the inner gate. There's entire books on this point as well. It's a profound point. It's also in the handout later for anxiety. This is the point I would teach my teenagers when the teenage girls would come in, painful periods, anxiety, stress, all of that. So under the school desk, you know, if they're anxious and they're going to get called on, this is very helpful with some slow, deep breathing, can be quite nice. So again, nausea, anxiety, those are strong indicators for this point, the inside point. Yes, please.
I think you kind of already said this, but with this point, if you've already become nauseous versus preventative,
yeah.
when I've used the bands, it doesn't work if you're already too far.
You know, for some people, that's absolutely the case. Yeah, I know for me, the strongest nausea I've ever experienced was during my first pregnancy. And I would just, like, whenever I wasn't needling a patient, I was holding this point until I bought some bands. And I found that even if I got nauseous, it would dial it down some, but that was just for me. And that's the sort of the beauty of these interventions. You can tinker with it and see, you know, will this keep me from getting nauseous? Or once I am nauseous, it still works. For some it will, for some it won't. Yeah. Any other questions? So then the next page. Oh no, we only have 6 minutes. I got a motor. Fatigue. So Bai Hui, 100 meetings again. I've used this so many times, driving on the freeway, slow boat to China from Seattle to Tacoma. Traffic up there is brutal. This is really helpful. So great for fatigue. The next page. Anxiety, nausea, which we just talked about. The last page, this is the most in-depth page with lots of different pictures all grouped together. Insomnia, of course, if we have a miserable headache, it's hard to go to sleep, right? So these are classically or commonly used points for insomnia, and there's a little bit of research information there too. So the hand point with all those orange dots, and then there's a line to HT7, which is heart 7. Heart 7, basically at the crease on the pinky side of your wrist, that's where heart 7 is. If anyone's ever used EFT, the tapping, I think heart 7 is one of the points that they use in that. Heart 7 is amazing to calm the spirit. So say if you're in bed, you can't go to sleep, just massage the side of your wrist. See if that'll help you to go to sleep. Spleen 6 we've got again on the inside above the medial malleolus. We've talked about that a bit. The next one down on the lower drawing, ST36, is stomach 36. Coolest story about that. Briefly, so when the Japanese were interred, they were forced to walk many horrible miles. And Japanese moxibustion, again, using the mugwort and directly burning it onto your skin. Well, they didn't have mugwort, but people would take their clothes, tear a little bit off, and use moxa directly on stomach 36. And the people who did that, many of them lived versus people who didn't. So that was kind of a historical story that one of my professors had taught me. So stomach 36, it translates, Zutsanli translates to 3-leg miles. So the idea is that this point gives you the energy to go 3 more miles. Conversely, it can help to relax and to calm and to, it's kind of hard to explain, but it is used for insomnia to help to relax and to calm. So how you find it is from your outside part of the knee, that indentation, the outside eye of the knee. You're going to measure your 4 fingers down from that. And it's a strong muscle there. And you're going to want to feel, for me, when I use this point in practice, I always feel for where the patient feels tenderness. So you want to just kind of go around the local area and see like, oh yeah, for me, that's a tender spot. Another way to locate it is to run your finger up the front of your tibia and where it kind of flares out. That's stomach 36. So again, from the outside eye of the knee, your hand width down, and Oh, just where that indentation is, the lower part of the knee, below the kneecap. Yeah. Does that make sense? It's a little bit trickier to find, I know, but basically, if you're below your knee on the outside, feel in the strong muscle there where you feel a tender spot. And it's an amazing point. Great for digestion, great for energy. Likewise, used in combination with other points to help with insomnia. So kidney 1 on the bottom of the foot, if this is the bottom of my foot, it's right at the arch in the center there. That's an amazing point for grounding, literally, it's the bottom of the foot, and to help with insomnia. Very painful for acupuncture, but very helpful. Also a great point for plantar fasciitis, heaven forbid if you're dealing with that. And then the point on the heel, basically, again, if this was my foot, this is where that insomnia point is. So you'd want to just palpate around on the foot for where you feel a tight spot, a tender spot. Very helpful. And also, one thing you might try before bed is just to do a foot soak in warm water, and that can help to bring your chi down and just relax and whatnot. And that is it. And I believe we're out of time.
Have we already done that?
Oh, sorry. You are right. Oh, no, heart 7, that's the same one as up above. Yeah, great question. So we've got the wrist point on the pinky side of the wrist. We've got spleen 6 and stomach 36, and then the foot points.
Is the heart 7 actually on the side, or is it?
Yeah, it's on the side, right on the crease here. Yep, right there. And we needle it either this way or that way. So really just massaging the side there, you'll be good to go. Yeah.
Are any of these particularly good for headache and just tension all along
Oh, the occiput, yeah.
the occiput?
Yeah, the occiput can be so tight and tender. I mean, definitely local points. So just massaging, which I'm sure you've been doing.
But any of these in particular?
No, UB60 would be a good one. So I'm glad you asked. So if anyone else is dealing with tension at the base of the occiput, on the outside of your ankle, between the ankle bone and your Achilles tendon, there's that kind of like indentation. That's an amazing point for the back of the head and for low back pain. So point here, work for both the head and the low back. So again, outside ankle bone, between that and your Achilles tendon, and just in that dippity-doo, that's urinary bladder 60. That's the technical term, dippity-doo. Any other questions before we, yes?
Is there like you've got pictures here, about like a sort of basic level introduction, pictures?
Oh, yeah.
Or something like that?
You know, there's some great websites for sure. One of my favorite books is called Voices of Chi. And it's maybe like, well, I don't remember the price now. I think it's maybe $5 used on Amazon. And that's just a nice kind of overview. If you want to really like give yourself a headache from the detail, then the web, this is the first book that I read. It's amazing. That has no Weaver. It's really well written. It's beautiful. It's by this guy, Ted Kapchuk. I think it's just K or maybe CK. He's one of our top researchers, brilliant guy, great clinician. It's thick, very small print, lots and lots of detail, but it would tell you all about the theory about qi, blood, yin, yang, etc. So those would be 2 good resources. Sorry, I failed to put my email address, but feel free to Google me. I'm easy to find if there's any other questions. So with that, we'll adjourn. Thank you, everyone.
Thank you.